Yes, here is your station.
Okay, ma'am, I get.
All right. If you've read and understood, considering it surgical pathology station, please tell me what are the differential diagnoses you'll consider for this case?
Okay, I have some differential diagnosis. It includes the septic arthritis or osteomyelitis, osteoarthritis, gout, pseudo-gout, or hamartosis, or maybe the tumor.
Very good. How would you go about and confirm your diagnosis?
Okay, ma'am. For confirm my diagnosis, I'll take the history, examination, and doing some investigation.
Like
It
which?
includes the CBC,
Yes.
CRP, X-ray of the joint, and aspiration of the joint, and collections and for CS, cytology, culture, and crystal, chemical crystal.
What are the most common organisms that can cause osteomyelitis?
Okay, ma'am. According to the age group, less than 4 months, commonly caused by the Staphylococcus aureus, Enterobacteriaceae, and group A and B Streptococcus. And age 4 months to 4 years, caused by the Staphylococcus aureus, Enterobacteriaceae, and group A Streptococcus. 4 months to adults, mainly caused by Staphylococcus aureus, Enterobacteriaceae, and Pneumococcal influenza. In adult group, it is caused by Staphylococcus aureus, Streptococcus, and Enterobacteriaceae. And
All
the
right, good.
patient with sickle cell disease, it is caused by Staphylococcus aureus and Salmonella.
Good. Thank you. Can you tell me what exactly is the pathogenesis behind this condition?
Okay, ma'am. It includes the invasion and the acute inflammation. In acute inflammation, there will be the fluid exudation.
Very good.
Then, um, then
What
polymer for
type of,
nuclear
yes,
leukocyte infiltration, increase
yes,
interosseous pressure, pain, and distribution of the blood supply. And
yes,
the second or third day, there is the suppuration, where the
yes.
pus appears in the medullary cavity, pass through the Volkmann's canals to the periosteum, periosteal elevation, and periosteal abscess, and spread to the shape of the bone, and from there it spreads to the bones,
Very good.
joints, and the surrounding tissue. And at the end of the first week, increase the interosseous pressure. Here will be necrosis by increased interosseous pressure, vascular stasis, in infection of the thrombosis, and the periosteal stripping
Yes,
that cause the disruption of the blood supply, and the bone destruction, bone dead, and formation of the sequestrum. At the 10
question.
to
All
12
right.
days,
Yes,
newborn, that is the involucrum is formed. And finally, when the infection is controlled and the interosseous pressure is released, the bone is healed.
very good. All right. Can you tell me what is necrosis? Can you define the
Yes,
term?
necrosis is the abnormal tissue death during life, and it is the pathological process and always accompanied by the inflammation.
How would you define the term necrosis? What is the difference between necrosis and apoptosis?
Apoptosis is a programmed cell death, and necrosis is the abnormal tissue death during life. Apoptosis is energy dependent, and necrosis is energy independent. Necrosis is a pathological, apoptosis is either physiological or pathological. In apoptosis, the single cell is involved, and in case of the necrosis, group of cell is involved.
Very good.
And
Okay.
inflammation is always accompanied by the necrosis, but not in apoptosis.
Right. If you could tell me this oncosis necrosis, what do you understand by that?
Ma'am, is it fibrinoid necrosis?
It's the extrinsic apoptosis. One of the,
No, ma'am, I can't see.
okay. Right. What more I had to ask you? Right. Please tell me how how the bone gets its blood supply, how
By
the infection
nutrient.
spreads in the bone, from which route?
Yes, ma'am. It's by hematogenous spread, mainly
Yes,
by the children, and the trauma. Trauma, in case of acute osteomyelitis, it is due to the open bone fracture or surgical exposed to the bones. In chronic osteomyelitis, neglected wound or from decubitus ulcer or diabetic foot, and contagious from the surrounding source of infection or
right. How
cellulitis.
this pus spreads through the bone's blood vessels and impairs the blood flow?
Yes, due to the increase the interosseous pressure,
Yes,
uh, uh, there will be accumulation of the pus in the subperiosteal region, then spread through the shaft of the bone.
good. What management would you offer this gentleman?
Okay, ma'am. At first, I will counseling about his condition, and I will advise him at first the past sent for CS and antibiotic according to the reports and local test policy, and consult with the microbiologist.
Right.
Then I'll give the supportive treatment for painkiller, and the correction of the dehydration and the splint test of the affected area, and
Okay.
if it is not improved, then I will advise him to remove the implant and the drainage of the pus.
Why implant needs to be removed?
Yes, ma'am, it's a septic foci. It may cause the biofilm, and it may loosening the implant.
All right. If you can tell me, if this plate is not removed and patient's condition does not improve, what are the consequences that you can be afraid can occur?
Okay, ma'am, it may be turned to the chronic osteomyelitis,
Leading
maybe
to?
the sinus formation,
Yes.
sinus formation, maybe the amyloidosis, maybe the malignant
No.
stage, maybe the
Malignant,
pathological
yes.
fracture.
Squamous cell carcinoma, because
Yes,
of the
ma'am.
sinus, it can result because of
Yes,
chronic.
chronic irritation.
Right, yes. Okay, right. Tell me how the nutrient artery enters and supplies the bone. From which end? What are the ends or
Metaphyseal end.
metaphyseal end? Yes,
Yes, ma'am.
very good. Okay, between epiphyseal end and the metaphyseal end, what is the point where there are no, after which there are no blood supply?
Ma'am, is it epiphyseal end?
After, yes, because then there'll be a growth palate and all that, and there'll
Yes,
be
ma'am.
no. Okay, right, good. Thank you. Would you or would you not give antibiotic to the patient?
Sorry, ma'am.
Would you or would you not give antibiotic to the
Yes,
patient?
I'll give the injectable form antibiotic after
Yes,
culture and
according to
sensitivity.
the, yes,
Yes, ma'am.
trust guidelines. All right, thanks. Thank you.
Thank you, ma'am.